So good morning to all of you. Good morning. Good morning. And welcome back to the Hardly MCQs, especially for you. Okay, let us begin. Let us start. So as you all know, I'm Dr. Pradeep Pawar, Professor of Anatomy. I've got a vast experience of teaching the undergraduates and the postgraduate students, especially in the entrance exams, India as well as abroad. Okay, so good morning, and we begin with this MCQs for today. Have a look, understand this and answer. You answer, then I start with the MCQ. Anyone? Yes, very good. So the answer is nerve to vastus lateralis. Nerve to vastus lateralis. Okay, I'll start. Have a look. During dissection, a student identifies femoral triangle. Right, the student identifies the femoral triangle. Anyone, what are the boundaries of femoral triangle? Now that the femoral triangle has come into the discussion, laterally is the medial border of sartorius. Medially is the medial border of adductor longus. The base is formed by inguinal ligament. So that becomes the femoral triangle. Base is inguinal ligament. Laterally is the medial border of sartorius, and medially is the medial border of adductor longus. At the apex of femoral triangle, where these two muscles meet, right at the apex of femoral triangle begins the adductor canal or the subsartorial canal, also known as the Hunter's canal. So during dissection, student identifies the femoral triangle below the inguinal ligament. On tracing below, he finds a small area lying on its medial aspect. So at the apex of femoral triangle, on the medial side is the adductor canal. The instructor addresses this as the Hunter's or the subsartorial canal. The student identifies all the contents in this canal except, very good. So answer is nerve to vastus lateralis. Students, can you quickly tell me, what are the boundaries? What are the how's the adductor canal formed? What are the boundaries of adductor canal? Let me just draw this for you. So that's the femur here. This is the femur. I've taken a section. I'll be taking a section through to the thigh. Oh, one moment. I'll just remove this charger. We're taking a section through the thigh. Okay, so that's the femur here. Femur. Students, if this is medial and if that's lateral, answer now. What is this muscle on the medial aspect of the femur? That's vastus medialis. A muscle on the lateral aspect, that's vastus lateralis. A muscle which is present on the anterior aspect of femur, that's the vastus intermedius. And about this is going to be the rectus femoris. Together, these four muscles are known as quadriceps femoris. Fine. So vastus medialis on the medial aspect of the shaft of femur. Now, as we go on the lower side, what is this muscle? This is the adductor longus. In the upper part is adductor longus, and as we go down, I can make that slide. So I'll just draw this adductor magnus like this. So upar ki taraf adductor longus, on the lower side is the adductor magnus, and the roof will be formed by what? What is this muscle which is going to form the roof? Sartorius. Very good. So what are the boundaries of adductor canal? This becomes the adductor canal. Adductor canal is present on the medial aspect of the thigh. Superior boundary would be the vastus medialis. The inferior boundary would be the adductor longus in the upper part, adductor magnus in the lower part. The roof would be formed by the sartorius. What are the contents of this adductor canal? One would be the femoral artery and the femoral vein. Together we call this as the femoral vessels. We get some nerves here. One is the nerve to vastus medialis. One nerve which is now becoming cutaneous. Right here it becomes cutaneous. What's that? Saphenous nerve. And there's one more nerve, that's the posterior division of obturator nerve. Posterior division of obturator nerve. So three contents of the adductor canal. This is the saphenous nerve. This is the posterior division of obturator nerve, posterior division of obturator nerve, and this is the nerve 2, vastus medialis, and these are the femoral vessels. Femoral vessels. That's it. So that's about the adductor canal. Is this clear to all of you? So answer is nerve 2 vastus lateralis. It doesn't lie in the adductor canal. Perfect. Now going to the next MCQ. So you're clear with this now? The answer is nerve 2 vastus lateralis. Femoral artery is there, saphenous nerve is there, the posterior division of obturator nerve is there. And students, yesterday I told you what is the saphenous nerve supply. Can anyone answer this? The saphenous nerve supplies the skin on the medial aspect of the leg and the foot up to the great toe. It's up to the great toe. The saphenous nerve supplies the skin on the medial aspect of the leg and the medial aspect of the foot up to the great toe. Who supplies the medial aspect of the great toe? Anyone? Who supplies the medial aspect of the great toe? Yes, the medial aspect of the great toe is supplied by the superficial peroneal nerve. Superficial peroneal nerve. I hope you know this. I've told this yesterday. If you want to tell me, I'll repeat this once again. The medial aspect of the great toe is supplied by the superficial peroneal nerve. Should I tell you this once again or no? You know this, no? Yesterday only I've told you all this. Okay, for the students who were not yesterday, if you want to tell me, I'll draw that for you. Okay, fine. So everyone has answered. We'll proceed to the next MCQ. Have a look at this. Yes, anyone answer this MCQ? I can't put a poll for you here, but that's fine. You can just tell me the answer. Good morning, good morning. Good morning. Answer this MCQ. Yes, answer is D. Very good. Answer is D for this. So, a 46-year-old man was involved in an automobile accident and sustained a tear of capsule of the CM joint of the right thumb. In view of his lung disease, it was decided to repair the laceration under a brachial plexus nerve block. The orthopedician decided to inject the anesthetic into the brachial plexus just below the clavicle. All the following statements regarding the brachial plexus are true except. The brachial plexus is formed by the anterior primary rami of C4 to T2 spinal nerves. Tell me, how is a normal brachial plexus formed? Can anyone answer this? How is a brachial plexus formed? It is formed by the anterior primary rami of anyone? Which spinal nerves? Which spinal nerves? Anterior primary rami of C5 to T. Yes, C5 to T1. Yes, it's C5 to T1. So normal brachial plexus is formed by the anterior primary rami of C5 to T1 spinal nerves. Agar C4 part leta, if C4 contributes to the formation of brachial plexus, we call this as a prefixed brachial plexus. If T2 takes part in the formation of brachial plexus, we call this as postfixed. Okay, so prefixed and postfixed brachial plexus. The axillary sheath is formed by the deep fascia. Tell me, which is that deep fascia which continues in the axilla as the axillary sheath? Can anyone answer this? Yes, that's the, which is that deep fascia of the neck? Well, the deep fascia of the neck are of three types. Students, you know this. The deep fascia of the neck are of three types. One is the investing, second is the pretracheal, and third is the prevertebral. So investing, pretracheal and prevertebral fascias. Out of these three fascias, which is the fascia which forms the axillary sheath, which continues as axillary sheath? Yes, that's the prevertebral fascia. So the axillary sheath is formed by the deep fascia, that's the prevertebral fascia of the neck. and surrounds the axillary vessels and the brachial plexus. Surrounds the brachial plexus is correct, but does it surround the axillary vessels as such? Matlab axillary artery and vein both? No. No. The axillary sheath encloses the brachial plexus and only axillary artery. Remember that. The vein is not a content of the axillary sheath. It's only the axillary artery. Clear to all of you? Be very clear about this. Axillary artery and the brachial plexus are present in the axillary sheath, which is derived from the prevertebral fascia. The cords are placed according to the names in the third part of axillary artery. That's wrong. The cords are present in which part of the axillary artery? Can anyone answer this? The cords of the brachial plexus are present in the first and the second parts of the axillary artery. First and second parts make cords of them. And what do we get in the third part? Nerves. In the third part we get the nerves. So cords are present in the first and the second part of the axillary artery. Yes, those are the cords. And third part we get the nerves. Nerves are present in the third part. And what is specific about the second part? Can anyone answer this? There's something very specific about the second part of axillary artery. Cords are present in the first and the second part. Agreed. But what is something very special in the second part? Anyone? The cords are placed according to the names in the second part. That's very specific. Cords are placed according to the names in the second part. First part may be cords होते हैं. In the first part also you get the cords, but the cords are not placed according to the names. Remember that. Clear to all of you? First and second part you get the cords, but first part mein the cords are not placed according to the names. They're just randomly placed. So where are we sure that this is lateral, this is medial and this is posterior cord? Second part of axillary artery. Second part. I hope this is clear to all of you. So then what do you get in the third part of the axillary artery? In the third part we get all the nerves. Nerves are present in the third part of the axillary artery. Nerves. I hope this is clear. Ulnar nerve is a branch of medial cord. Yes, correct. Ulnar nerve is a branch of medial cord. If you can quickly tell me, students, which are the other branches of medial cord? Which are the other branches of medial cord? One is the medial pectoral nerve, the medial root of median nerve, medial pectoral, the medial root of median nerve, the medial cutaneous nerve of arm, medial cutaneous nerve arm, medial cutaneous nerve of forearm, medial cutaneous nerve forearm, and ulnar nerve. Ulnar. Very good. So these are the branches of medial cord. Students, can you quickly tell me what are the muscles supplied by ulnar nerve in the forearm? Is there any muscle supplied by the ulnar nerve in the arm? No, ulnar nerve does not supply any muscle in the arm. So is there any muscle supplied by ulnar nerve in the forearm? Can anyone answer this? Muscle supplied by ulnar nerve in the forearm? Yes, it does supply muscles in the forearm. One is the flexor carpi ulnaris and the medial half of flexor digitorum profundus. It supplies the flexor carpi ulnaris and the medial half of flexor digitorum profundus. Perfect. So that's correct. You understood. So we go to the next MCQ, students. Answer this. Yes, anyone? Okay, I'll just go through it. Now, a 60-year-old man was eating dinner in a seafood restaurant when he suddenly choked on a piece of fish. Assuming that the bone was struck in the pyriform fossa, all the following statements are correct except. But first tell me, where is the pyriform fossa? Where is this pyriform fossa located? Okay, have a look at this slide. Tell me, students, what is this view? Ye kahan se dekh rahe? Where are you looking this slide from? What have we cut? We've cut the pharynx from behind. Okay, we've cut the pharynx from behind. and we have opened the pharynx. This is a view from back side. पीछे से आप देख रहे हो. We have cut the pharynx from behind and we have opened the constrictor muscles of the pharynx. We have opened the constrictor muscles of the pharynx. So this is the nose, nasal cavity. So what is this pharynx behind the nose? That's the nasopharynx. That's the oral cavity. And what is this pharynx behind the mouth? That's the oropharynx. Now tell me students, what is this structure? That's the epiglottis. What are these folds here? What are these folds? These are the aryepiglottic folds. Aryepiglottic folds. That's the epiglottis here. These are the aryepiglottic folds. And you tell me, if we enter inside this, if we go inside this aryepiglottic folds, where do we go? Into the larynx. We are right inside the larynx. Clear? And this pharynx behind the larynx is known as what? The hypopharynx or the laryngopharynx. Hypopharynx or the laryngopharynx. Clear? Fine. Look at this slide. And if you can answer this. Look at this slide and tell me, what is this now? This is the epiglottis. Epiglottis, correct? This is the epiglottis. What are these folds here? Students, what are these folds? These are the aryepiglottic folds. Correct? These are the aryepiglottic folds. So what is this? This is the inlet of the larynx. Inlet of the larynx. So that's the epiglottis. These are the aryepiglottic folds. This becomes the inlet of the larynx. On either sides of the aryepiglottic folds, on either sides, what is this cartilage, students? This is the thyroid cartilage. Thyroid cartilage. This is the hyoid bone. Outside, bahar ki taraf hai ye. That's the hyoid bone. That's the thyroid cartilage. What is this membrane here? What is this membrane here? That's the thyrohyoid membrane. This is the thyrohyoid membrane. And this fossa here between the thyroid cartilage and the aryepiglottic folds. Look at this. Between the aryepiglottic folds and the thyroid cartilage, that area is known as pyriform fossa. That is the pyriform fossa. Clear, students? On either sides is the thyroid cartilage and these are the aryepiglottic folds. The space between them is what we call as the pyriform fossa. Pyriform fossa. Perfect. Now that's the hyoid bone. That's the thyroid cartilage. What is this membrane? That's the thyrohyoid membrane. And students, if you can see here, there's a small opening here. You can see this opening in the thyrohyoid membrane. And this is for what? Tell me, what is the structure which pierces the thyrohyoid membrane and comes in? Can anyone answer this? Structures piercing the thyrohyoid membrane. You can see this? Yes. There's someone who's going to pierce the thyrohyoid membrane and come inside. क्या हो सकता है? चलो, answer this, students. Structures piercing the thyrohyoid membrane. Can anyone answer this? Yes, internal laryngeal nerve and the superior laryngeal vessels. The internal laryngeal nerve and the superior laryngeal vessels, they pierce the thyrohyoid membrane. They come here right inside the pyriform fossa. And now this internal laryngeal nerve and the superior laryngeal vessels will be passing between the constrictor muscle of the pharynx. Okay, they'll go between the middle and the inferior constrictor muscles of the pharynx. Then they go into the pharynx and then to the larynx. Then to the larynx. So that's the internal laryngeal nerve and vessel. I'll just mention this for you here. This is a very important thing. So I will just jot this down. Internal laryngeal nerve and the superior laryngeal vessels. Okay. So internal laryngeal nerve and superior laryngeal vessels. First, they pierce, just some important things, pierce thyrohyoid membrane. They pierce the thyrohyoid membrane. They pierce the thyroid membrane, lie in the pyriform fossa. They lie in the pyriform fossa. Now passes between middle constrictor and inferior constrictor muscles. Middle and the inferior constrictor muscles of the pharynx. Fourth, supplies mucous membrane, That's sensory. Supplies the mucous membrane of the larynx about the vocal folds. Supplies the mucous membrane of the larynx about the vocal folds. Also supplies posterior most part of the tongue and epiglottis. This should be perfect. So these are all the possible MCQs that you get on this internal laryngeal nerve and the superior laryngeal vessels. Clear to all of you? So the internal laryngeal nerve and the superior laryngeal vessels, they will first pierce the thyroid membrane, come to lie in the pyriform fossa. Now they will pass between the middle and the inferior constrictor muscles of the pharynx. They supply the larynx above the vocal folds. The mucous membrane, that is sensory supply of the larynx above the vocal folds. They also supply, students, they also supply the posterior most part of the tongue and the epiglottis. Posterior most part of the tongue and the epiglottis. Perfect. Okay, is this clear to all of you? That's it. So coming back to the MCQ, students, here. So all the following statements are correct except about the pyriform fossa. It lies on either sides of the entry of larynx. What do you say? Correct? On either sides of the entry of larynx. That means it lies between the aryepiglottic folds and the thyroid cartilage. That's the pyriform fossa. Between the aryepiglottic folds and the thyroid cartilage. So it lies on either sides of the entry into the larynx. That's perfect. The mucous membrane of the pyriform fossa is sensitive and innervated by recurrent laryngeal nerve. That's wrong. That's wrong. The mucous membrane of the pyriform fossa would be innervated by, yes, internal laryngeal nerve. Yes, very good. Internal laryngeal nerve. It is bounded laterally by the thyroid cartilage and the thyrohyoid membrane. Perfect. It is bounded medially by the aryepiglottic folds. That's correct. Clear to all of you? Yes. And tell me, who supplies the sensory supply of the larynx below the vocal folds? Students, who supplies the sensory supply below the vocal folds? That's the recurrent laryngeal nerve. Recurrent laryngeal nerve. And what is the external laryngeal nerve supply? Internal laryngeal nerve is sensory. Agreed. Yes. And what is the external laryngeal nerve supply? It is motor. It is motor. And the external laryngeal nerve is going to supply the cricothyroid muscle. It supplies the cricothyroid muscle. Tell me, students, what is the action of cricothyroid? What is the action of cricothyroid? Anyone? It is a tensor of the vocal cord. It tenses the vocal cords. And when the vocal cords are tensed, we get a high pitch to the voice. A high pitched voice is because of the tensor action of the vocal cords. That's exactly what the cricothyroid does. And if this cricothyroid is paralyzed, if the external laryngeal nerve is damaged, the cricothyroid gets paralyzed, the person talks in a very low pitched voice. The pitch of the voice is lost. The person talks in a very low pitched voice. Okay? Fine, that's it. So coming to the next MCQ, students. Yo, answer this. While studying the mediastinal surface of the right lung, a first prof student notices a vein over its hilum. He identifies it as the azygous vein. He further traces this vein and finds it opening into, can anyone answer this? SVC. Very good. So the azygous vein arches over the hilum of the right lung. The azygous vein opens into the SVC. Is this clear? So the structure which arches over the hilum of the right lung is azygous vein. Students, can you tell me the structure which arches over the hilum of the left lung would be what? The structure which arches over the hilum of left lung. Anyone? Yes. Structure which arches over the hilum of the left lung is arch of aorta. Arch of aorta. Arch of aorta. Perfect, perfect. Now listen to this thing, students. ये जो है ना azygous vein, that's the IVC, that's the renal vein. ये renal vein है, that's the IVC, that's the renal vein. In fetal life, understand this. You get plenty of MCQs on this topic, azygous vein. In fetal life, this azygous vein arises from the IVC. This azygous vein arises from the IVC at the level of renal veins. At the level of renal veins arises this azygous vein from the IVC, and this is what we call as the lumbar azygous. Lumbar azygous. But that's in fetal life. Don't write this. Just listen here. I'll write this for you. Don't write this. It's extremely important. So fetal life में क्या होता है? The fetal life में the azygous vein begins from the IVC, and that is what we call as the lumbar azygous. This is in fetal life. After birth क्या होता है? After birth this degenerates off. ये degenerate होता है. And this remains as a fibrous cord. अब ये fibrous cord बन जाता है. Understanding? So you get some MCQs like this. True about azygous vein. True about azygous vein. Fibrous cord is a remnant of it. Fibrous cord is a remnant of it. Correct? ये है ना, this one remains as a fibrous cord. Don't write, just listen. So this one, which was beginning in the fetal life as lumbar azygous, after birth remains as a fibrous cord. Now students, in us, if you can tell me, in us, how's the azygous vein formed? In us. Anyone, can you answer this? How's the azygous vein formed in us? It is formed by the union of, there's a vein which is ascending from the lumbar vertebrae. What do you call this vein as? A vein which is ascending from the lumbar vertebrae. That's the ascending lumbar vein. Ascending lumbar. And there's a vein which comes below the T12, 12th rib. It comes below the 12th rib. What do you call this vein as? The subcostal vein. Subcostal. So the right ascending lumbar and the right subcostal now joins to form the azygous vein. Azygous vein. Okay. So these are certain things which are very important. I'll just jot this down for you. So in fetal life, yes, azygous vein begins from the IVC. At the level of renal veins. Begins from the IVC at the level of renal veins. This is what we call as lumbar azygous. Begins from the IVC at the level of renal veins. That's lumbar azygous. After birth, remains as a fibrous cord. After birth, it remains as a fibrous cord. Now, the right ascending lumbar and right subcostal veins join to form azygous vein. Clear, students? So now the right ascending lumbar and the right subcostal joins to form the azygous vein. Now students, if you can tell me, how does the azygous vein come inside the thorax? That's in the abdomen. So how does the azygous vein enter the thorax? It passes through the aortic opening of the diaphragm. Correct? It enters the thorax through the aortic opening of the diaphragm. Then it lies in the posterior mediastinum. It arches over the hilum of the right lung. It opens into the SVC. At what vertebral level does it open into the SVC, students? T4. It opens into the SVC at T4. Can anyone tell me how's the hemiazygous vein formed? Hemiazygous vein. The hemiazygous vein is formed from hemiazygous vein. 5, 6, 7, 8. 5, 6, 7, 8. 5, 6, 7, 8. On the left side, left posterior intercostal veins. Left posterior intercostal vein joins to form accessory hemiazygous vein. Accessory hemiazygous vein. And 9, 10, 11 and 12 joins to form the hemiazygous vein. Clear, students? So 5, 6, 7, 8 on the left side, the posterior intercostal veins on the left side joins to form the accessory hemiazygous. 9, 10, 11, 12 joins to form the hemiazygous vein. Okay, perfect. Anything else? The right ascending lumbar and the right subcostal. Ye clear hai? This will join to form the azygous vein. Brachiocephalic vein. How's the brachiocephalic vein formed? Can anyone answer this? How's the brachiocephalic vein formed? The brachiocephalic vein is formed by the joining of the internal jugular vein and the subclavian vein on both the sides. The right internal jugular, the right subclavian joins to form the right brachiocephalic. The left internal jugular, the left subclavian joins to form the left brachiocephalic vein. Now, which brachiocephalic vein is longer? Can anyone answer this? The left brachiocephalic vein is longer in size. It joins with the right brachiocephalic and forms the SVC. Perfect, students, perfect. Now we go to the next MCQ. Answer this. Anyone? Ribs है ना करना थी. Answer is not D. Okay, look here. A 70 years old person complains of severe fever, throat infection and chest pain. Suspecting COVID-19, the physician starts auscultating the chest with all necessary precautions. To auscultate the posterior segment of the lower lobe, the surgeon places the stethoscope in the triangle of auscultation. All the following structure forms the boundary of this triangle except, yes, what is the triangle of auscultation bounded by? Just have a look at this. This is the triangle of auscultation. I'll just magnify the slide for you. Yes, that's the triangle of auscultation here. This is the triangle. What are the boundaries of this? Who's medially? Trapezius. Medially is the trapezius. Who's below? Latissimus dorsi. So below is the latissimus dorsi. Medially is the trapezius. And who's lateral? Laterally is the medial border of scapula. Laterally is the medial border of scapula. It's not the lateral border. It's the medial border of scapula. So this becomes the triangle of auscultation. Triangle of auscultation. Answer is C for the C. Triangle of auscultation. Clear as students? So what are the boundaries of triangle of auscultation? Medially is the trapezius. Laterally is the medial border of scapula. Medial border. And the base is formed by the latissimus dorsi. Below will be the ribs. The floor would be formed by the ribs. 6th and the 7th ribs. They form the floor of the triangle of auscultation. Triangle of auscultation. Is this clear to all of you students? Okay, come quickly, you answer this. What is this muscle here? Come on, just put the initial. That's fine. Just put the initial here. What's this? What's this muscle? Come on, students. Just put the initials. What is this muscle? What are seen in the slide? This is another very important visual for you. So, ye kaun hai? Deltoid. Identify this muscle. This muscle here. This is the trapezius. Trapezius. That's the latissimus dorsi. Latissimus dorsi, what would this muscle be which begins from the lateral border of scapula? Students, this muscle which begins from the lateral border of scapula. Ye hoga teres minor, ye hoga teres major, right? That's teres minor, that's teres major. And which are these muscles which are attached to the medial border of scapula? Medial border of scapula from the superior angle to the spine. Here, from the superior angle to the spine, what is this muscle going to be? The levator scapulae. Levator scapulae. Opposite to the spine is the rhomboides minor, and below the spine is going to be the rhomboides major. Rhomboides major. So levator scapulae, rhomboides minor and rhomboides major. What is the action of rhomboids? When this rhomboids contract, they're going to pull the scapula back towards the vertebral column, and this is what we call as retraction of scapula. Retraction. So retraction of scapula is done by whom? The rhomboids. The rhomboidus minor, the rhomboidus major, and the someone else also. Tell me now, students, what is this muscle? That's a trapezius. What are these fibers of trapezius? Upper fibers. What are these fibers of trapezius? Middle fibers. And what are these fibers? The lower fibers. What is the action of upper fibers of trapezius? This upper fibers, when they contract, they do this. What's this? The shrugging of shoulder. They do shrugging of shoulder. The middle fibers of trapezius, they begin from this vertebrae, from the cervical and thoracic vertebrae, inserted on the spine of the scapula. Look at this. These are the horizontal fibers or the middle fibers. When this middle fibers contract, what do? Retraction of the scapula. The middle fibers of trapezius, when they contract, they go to retraction of scapula. So what I want you to understand is, students, retraction of scapula is done by the rhomboidus minor, the rhomboidus major, as well as the middle fibers of trapezius. They should be perfect, very important. Middle fibers of trapezius. And what does this lower fibers of trapezius do? Look at this, students. The lower fibers of trapezius, they turn like this. They turn and they get inserted into the spine here. The lower fibers of trapezius, they turn and they get inserted into the spine. When these fibers contract downwards and downwards, what will they do to the scapula? They will rotate the scapula like this, and this is what we call as an overhead abduction. Overhead abduction. Clear? So the lower fibers of the trapezius, along with serratus anterior, they're going to do overhead abduction. This should be perfect. Upper fibers, they do shrugging of shoulders. Yes, correct. Soumya, yes. The upper fibers of trapezius, they do shrugging of shoulders. The middle fibers of trapezius, they are going to retract, the scapula retract. And the lower fibers of trapezius, when they contract, they do overhead abduction. Am I clear to all of you? Right, perfect. See the next slide. Answer this. A 45 years old man consulted the physician for difficulty in defecation. On examination, a mass is felt in the anal canal. Histological examination revealed cancerous lesion. The superficial inguinal lymph nodes drains all the following. Tell me, anal canal, anal canal, na? On examination, a mass is felt in the anal canal. Okay, so superficial inguinal lymph nodes drains all the following except. Anyone, can you answer this? Yes, very nice. It drains the anal canal except anal canal above the dentate line. Anal canal below the dentate line would be drained by what? Superficial inguinal lymph nodes. Superficial inguinal lymph nodes. Okay, I'll just tell you this, students, this is extremely important. Superficial inguinal group of lymph nodes, upper medial group. बस मैं ये upper medial group बोलता हूँ, हाँ, upper medial. So superficial inguinal lymph nodes, upper medial group, upper medial. Superficial inguinal group of lymph nodes, the upper medial group, what do they drain? They drain the anterior abdominal wall. They drain the anterior abdominal wall below the umbilicus. Anterior abdominal wall below the umbilicus. Skin and fascia of the perineum. Skin and fascia of the perineum, including external genitals. So skin and fascia of the perineum, including the external genitals, except, can anyone answer this? Except what? Except the glans penis and the glans clitoris. This is very important, students. बहुत MCQs आते हैं, clinical MCQs also based on this. Upper medial group, I'm just telling you upper medial group because that's very important. So anterior abdominal wall below the umbilicus, the skin and fascia of the perineum, including the external genitals, except the glans penis and clitoris. Penile part of male urethra. Penile part of the male urethra. Fourth, anal canal below the dentate line. Anal canal below the dentate line. Vagina below the hymen. Vagina below the hymen. And sixth, cornu of the uterus. Cornu of the uterus. Cornu is the junction of the fallopian tubes with the body of the uterus. The junction of fallopian tubes with the body of the uterus, that's a cornu. Clear? So this is what the superficial inguinal group of lymph nodes, the upper medial group drain. This is extremely important to students. Just remember all these things. I've already told you somewhere or the other, so that's fine. Okay, we come to the other MCQs. Tell me, anterior abdominal wall below the umbilicus drains into the superficial inguinal lymph nodes. External genitals, yes. The lower limb drains into the vertical group of lymph nodes. Vertical group. Anal canal above the dentate line would drain into what? Internal iliac lymph nodes. Internal iliac lymph nodes. Okay. So anal canal above the dentate line would drain into the internal iliac lymph nodes. Come on, students, coming to the next MCQ. Typing on the computers hours together for several days, an IT professional found weakness in his right hand. On examination, carpal tunnel syndrome is suspected. Injury to the median nerve results in one of the following. Can you answer this? Yes, students. Vismaya? No, that's wrong. It's not correct. D कैसे होगा? Loss of sensation over the thenar eminence नहीं होता ना. It doesn't occur in carpal tunnel syndrome. Carpal tunnel syndrome में loss of sensation over the thenar eminence is not seen. It will be there. Sensations over the thenar eminence is going to be there if the nerve gets compressed in the carpal tunnel. If the median nerve gets compressed in the carpal tunnel, these sensations are going to be intact. In fact, they are going to be intact. Why? You tell me, which is the nerve which supplies the skin over the thenar eminence? Can anyone answer this? Can anyone answer this? The nerve which supplies the skin over the thenar eminence. This is the palmar cutaneous branch of median nerve. Palmar cutaneous branch of median nerve. And where is this given? In the forearm. This is given in the forearm, students. समझ में आ रही है? Palmar cutaneous branch of median nerve, and that's given in the forearm. So students, if there's a carpal tunnel syndrome, this nerve is spared. इसको कुछ नहीं होता. This nerve goes above the flexor retinaculum and supplies the skin over the thenar eminence. Clear है? So there will be no loss of sensations over the thenar eminence. If the median nerve is injured in the forearm or in the axilla or in the arm or in the axilla, there will be a loss of sensations here because palmar cutaneous branch will be involved. Is this clear, students? Option D is wrong. Loss of sensations over the thenar eminence is wrong. Someone answered A. Results in one of the following. Adductor polysis. Tell me, adductor polysis, what does it do? It does adduction of the thumb. Adduction of the thumb. And adductor polysis is supplied by which nerve? Can anyone answer this? Adductor polysis is supplied by ulnar nerve. Adductor polysis muscle is supplied by ulnar nerve. It is in fact, it is known as graveyard of ulnar nerve. Graveyard of ulnar nerve. Why is it known as graveyard of ulnar nerve? Because ulnar nerve, after supplying all these 15 muscles, yes, sorry, 15 muscles ulnar nerve supplies. After supplying all these 15 muscles, the ulnar nerve goes and ends in the adductor pollicis muscle. It goes and buries itself in the adductor pollicis muscle. This muscle is therefore known as the graveyard of ulnar nerve. Okay, it is therefore known as the graveyard of ulnar nerve. Clear students? ये clear है? Tell me, flexor digitorum superficial paralysis. Tell me who supplies the flexor digitorum superficialis? Who supplies? Anyone? Tell me, who supplies the flexor digitorum superficialis? Flexor digitorum superficialis is a muscle of the forearm. Forearm है ना? Flexor digitorum superficialis is a muscle of the forearm. It is supplied by the median nerve. It is supplied by the median nerve, but in forearm. So flexor digitorum superficialis is supplied by median nerve in the forearm. Median nerve in the forearm. Okay, flexor digitorum superficialis is supplied by median nerve in the forearm. अब ये जो flexor pollicis brevis है ना students, flexor pollicis brevis, I'll just tell you this. Flexor pollicis brevis. You tell me this is a muscle of what? Where is this muscle? Where is this muscle? Flexor pollicis brevis. Can anyone answer this? Flexor pollicis brevis is a muscle of thenar eminence. Students, flexor pollicis brevis is a muscle of thenar eminence. इसके दो heads हैं. One superficial head and the other one is a deep head. Superficial head and the deep head. Superficial head is supplied by median nerve and the deep head is supplied by ulnar nerve. Superficial head is supplied by median nerve and the deep head is supplied by ulnar nerve. Clear to all of you? So which are the muscles supplied by median nerve in the hand? Median nerve in the hand. After it passes through the carpal tunnel, one is the abductor pollicis brevis, flexor pollicis brevis, superficial head, opponens pollicis, first and second lumbricals. First and second lumbricals. These are the muscles supplied by median nerve in the hand. Abductor pollicis brevis, flexor pollicis brevis का superficial head. So if the median nerve is compressed in the carpal tunnel, which muscle is going to be paralyzed? Flexor pollicis brevis, not completely, partially. Because only the superficial head will be paralyzed. The deep head is supplied by ulnar nerve, so deep head will be intact. समझ में आ रही है? So superficial head will be gone. Superficial head is supplied by median nerve. And the deep head is supplied by ulnar nerve. So there will be a partial paralysis. हाँ विस्मया, anterior interosseous nerve नहीं. It is this. It is median nerve. So these are the muscles supplied by median nerve in the hand. These are the muscles supplied by median nerve in the hand. So if there's a carpal tunnel syndrome, if the median nerve is injured, compressed in the carpal tunnel, how many muscles will be paralyzed? This fine muscles will be paralyzed, plus the skin will be gone. Skin. Okay. The skin will be gone. How much part of the skin will be gone? I'll just make this for you, students. I'll just make this for you. Skin है ना? एक मिनट. Sensations on the skin will be lost. If you know this, that's fine. Just a quick go through revision. This is a thenar, that's a hypothenar eminence. Quickly answer this. This is the palmar aspect and that's the dorsal aspect. ये dorsal aspect है, ये palmar aspect है. Okay. So tell me now, who supplies the skin over the thenar eminence? That's the palmar cutaneous branch of median nerve. This is the palmar cutaneous branch of ulnar nerve. So what is the median nerve supply? The median nerve is going to supply the palmar aspect of cutaneous supply, I'm telling you, of 3.5 fingers. 1, 2, 3.5 fingers. 3.5 fingers on the palmar aspect. Okay, 3.5 fingers on the palmar aspect. Who supplies this 1.5 fingers on the palmar aspect? याद है आपको? This 1.5 fingers is supplied by whom? This is supplied by the superficial branch of ulnar nerve. Superficial branch of ulnar nerve. And this is supplied by whom? Medial nerve. This is supplied by the medial nerve. Medial nerve. Now, the same medial nerve goes to the dorsal aspect. Students, the same medial nerve goes to the dorsal aspect, supplies the distal phalanx of the thumb, distal and middle, distal and middle, and distal and middle half. This is medial nerve. I want you to be very clear with this. So, students, if the medial nerve is compressed in the carpal tunnel, carpal tunnel में अगर compression होता है, how many muscles are going to be paralyzed? 5 muscles. 5 muscles which are supplied by the medial nerve. I've just told you that. Abductor pollicis brevis, flexor pollicis brevis का superficial head, opponens pollicis, and 2 lumbricals, first and second lumbrical. So 5 muscles would be paralyzed, and there will be a loss of sensations of the skin. Okay, there will be a loss of sensations of the skin on the palmar aspect. How much? 3.5 fingers. This is palmar aspect. So 3.5 fingers on the palmar aspect. Sensations will be gone. And 3.5 fingers on the dorsal aspect, except the proximal phalanx. Proximal phalanx के sensations are going to be intact. So 3.5 fingers except the proximal phalanx. Yes, dorsal middle 2. Yes, dorsal middle 2. I'll tell you. So who's going to supply this which is left here? 1.5 fingers except the proximal phalanx. This is supplied by the superficial branch of ulnar nerve. Superficial branch of ulnar nerve. And now you tell me, students, who's going to supply this proximal phalanges of 2.5 fingers? This. Yes. KV, who's going to supply this? This is the superficial. 2.5 is for this superficial branch of radial nerve. Superficial branch of radial nerve. And who's going to supply this? What is left now for us is this. Yes. Who's going to supply this? 2.5 on the medial aspect. That's the dorsal cutaneous branch of ulnar nerve. Dorsal cutaneous branch of ulnar nerve. So medial nerve on the dorsal aspect supplies 3.5 fingers. वैसे ही जैसे ये था ना palmar aspect पे जैसे 3.5 fingers it supplies. The same medial nerve goes to the dorsal aspect, supplies 3.5 fingers except proximal phalanx. 3.5 fingers except proximal phalanx. Who supplies this 1.5 fingers? The superficial branch of ulnar nerve. The same superficial branch goes to the dorsal aspect, again supplies 1.5 fingers except the proximal phalanx. Then proximal phalanges of 5 fingers are left. So 2.5 fingers ka proximal phalanges and the dorsum is supplied by the superficial branch of radial nerve. 2.5 fingers ka proximal phalanx and the dorsum is supplied by the dorsal cutaneous branch of ulnar nerve. Dorsal cutaneous branch of ulnar nerve. Is this clear? Yes, KV? No confusion, no? I hope this is clear to all of you. So students, one more MCQ. Before I proceed to the MCQ, let me just brief you about our platform. So we've got a Plus subscription in which there are daily live classes, live quizzes, learning from the top educators, study on the device of your choice, and you can access to over 25,000 plus MCQs from the bank. An iconic subscription, students, where you get the best of Unacademy and pre-planner. Some special class features in which there are daily live classes, poll for the learners, never miss a class with proper notifications being given. Raise a hand technique. Suppose if you miss a class, you get the lecture notes in the form of PDF, you get the recorded lectures, and anytime, anywhere you can access the lectures and get your doubts solved. A highly effective and updated question bank with latest questions and detailed explanatory answers has been specially prepared for you. So these are our last NEET PG toppers. Very good marks, very good ranks they've got. We congratulate all of them once again. Raise a hand technique in which if you press the icon, you can directly talk to the educator. Students, these are some ritual tests that we have. A specific timing, specific days. So educator curated test series, that's on Wednesday 9 p.m. These are subject-wise tests. FMG Grand Test Series, Wednesday 9 a.m. and 2 p.m. Study with me, the YouTube test series, Friday 9 p.m. Saturday special class marathon best test series, Saturday 9 p.m. And we have got a grand test for all our courses across on Sunday 9 a.m. So these are all free tests. Students, do give this test and crack them. We're starting with 2 new batches, students. Focus FMG 2022 comprehensive batch from 22nd of December. We are also starting with Target NEET PG 2022 MCQ discussion batch from 22nd of November. And students, the NEET PG compact is once again here. Today, it's right today, 5 p.m. 45 MCQs for 60 minutes. Give this exam, spread this to your friend also, spread this word to your friend also, let them also give the exam, let them also avail the benefit. There are a lot of free scholarships to be given. You can get an Unacademy subscription too. So don't forget the date, it's today 5 p.m. 45 MCQs, 60 minutes. Okay. Download the Unacademy app and subscribe to it. Okay, just one last MCQ. I come to this. Answer. A 25 years old female complains of swelling in the groin. On examination, a small mass is seen protruding in this area below and lateral to the pubic tubercle. Students, below and lateral. So what do you say? It's below and lateral to the pubic tubercle. Something below and lateral to the pubic tubercle would be what? Swellings in the groin. If it's above and medial to the pubic tubercle, that accounts for what? Inguinal hernia, correct? Above and medial to the pubic tubercle is inguinal hernia. Below and lateral to the pubic tubercle would be femoral hernia. Below and lateral is femoral hernia. The surgeon diagnoses this as femoral hernia, correct? Now, considering the femoral sheath and femoral canal, which of the following statement below is correct? The femoral sheath is a continuation of fascia transversalis. What do you say? What do you say, students? Femoral sheath is a continuation of fascia transversalis? Yes. So anterior wall of femoral sheath is formed by fascia transversalis. The posterior wall of femoral sheath is formed by fascia iliaca. Very good. So anteriorly it's fascia transversalis and posteriorly it's fascia iliaca. Fascia iliaca. Correct. Anteriorly fascia transversalis, posteriorly fascia iliaca. The sheath contains the femoral nerve. What do you say? This is wrong. Wrong. The femoral sheath contains only the femoral vessels. Only femoral vessels. The nerve is outside the femoral sheath. Nerve is outside the femoral sheath. Only femoral vessels in the femoral sheath. The femoral vein lies lateral to the femoral artery within the sheath. क्या बोलते हो? Correct है? The femoral nerve lies, the femoral vein lies lateral to the femoral artery? No, the vein is medial. Correct? The vein is medial, the artery is lateral. So this is wrong. The vein is medial, artery is lateral. The medial boundary of femoral ring is formed by pectinate ligament. Yes, that's right. The medial boundary of femoral ring is formed by pectinate ligament. Let me just draw this for you, students. Let me just draw this for you. Okay. Correct. So that's the femoral sheath. That's the lateral, that's the intermediate, and that's the medial compartment. Yes. What is this? This is the lateral compartment. What is present in the lateral compartment? This is going to be the femoral artery plus the femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve. Okay, so that's the femoral artery and the femoral branch of genitofemoral nerve. What is in the intermediate compartment? Femoral vein. And the medial compartment is empty. It is known as the femoral canal. Femoral canal. The upper part of femoral canal is known as the femoral ring. Femoral ring. What are the boundaries of this femoral ring, students? I'll just mention this. 1. The anterior boundary is formed by the inguinal ligament. Anterior boundary is formed by the inguinal ligament. Anterior is 1, medial is 2. Medial boundary is formed by the lacunar ligament. The posterior boundary, that's number 3, that's formed by the pectinate ligament, and the lateral boundary, that's number 4, and this is formed by the septum separating it from femoral vein. Septum separating it from the femoral vein. Okay, so anteriorly is the inguinal ligament, medially is the lacunar ligament, posteriorly is the pectinate ligament, and laterally is the septum separating it from the femoral vein. That's it. I hope these things are clear to you and all of you understood the lecture, enjoyed the lecture. Thank you, students. Thank you for a patient listening. Thank you to all of you. Okay, I stop here. Thank you to all of you.